I'm Dr. Sathya. I'm a clinical director in Cloudnine Hospital for the Department of Fertility. I'm often asked by patients as to why their IVF cycle failed. So I'd like to present a brief talk on how we evaluate a failed IVF and what we can do to improve things for the next cycle. So whenever we have an index couple whose IVF has failed, we go back through our notes to see whether we can find some clues as to why the cycle could have failed. The first information that we look for is the quality of gametes, that is the eggs and the sperms. Were the eggs of good quality? Were the sperms of good quality? Was the lining of the uterus good enough? Was the process of transferring the embryos easy? Were the embryos of good enough quality for us to transfer? These are the obvious first questions that come to our mind. We then wish to know if the medicines that were prescribed, which we call as luteal support following embryo transfers, were taken appropriately by the patient. If no clue comes out of these, then we try to look back in the history to see if there are any other factors which have contributed to this failure. The most important factor determining success is the female age. So we look at that, whether that could have contributed. The second thing is duration of fertility. The longer duration of infertility, the lower is the chance of success. The third thing that we look for is, are there any other factors outside the uterus which can contribute to the failure? Number one being a swelling of the tube, it's called hydrosalpinx. So if the tubes are blocked and there are fluid content inside the tube, then this fluid can trickle into the uterus and damage the embryos. So we get an ultrasound done to look for hydrosalpinx. This would have obviously been done even before the IVF, but sometimes things do get missed and we need to check again when a failure happens whether we have missed a hydrosalpinx or not. The other thing on the wall of the uterus that we need to look for is a condition called adenomyosis, which are small blood collections in the muscle layer of the uterus. And if this happens and this is found on ultrasound, or there is a suggestion of adenomyosis on ultrasound, then the next time over we need to give additional medicines before we transfer the embryos. The third thing we would like to look for within the uterus is something called polyp. It's a fleshy growth inside the uterus which could have contributed to the failure. So if that is found, then we would do a test called hysteroscopy, wherein we put in a telescope into the uterus from below and get a magnified view of the inside. And if we find a polyp, then that would be cut off. If there are any other findings on hysteroscopy like adhesions or septums, they would be dealt with at that sitting. So these are some of the factors in the female factor that could have contributed to the failure. In the male factor, if the semen analysis is looking obviously normal, we want to do an additional test on the sperms, and that's called sperm DNA fragmentation. As you know, both the father and the mother contribute their DNA to get a baby. Unfortunately, we can't check the wife's egg's DNA because they are inside her body. But a man can conveniently provide his semen sample and we can look at his sperm DNA breakage, which we call as sperm DNA fragmentation test. And if the sperm DNA fragmentation test shows a high value, that could have contributed to the failure as well. So that needs to be looked at. In case we find that the woman is of a higher age group, that is above 38, then for the next IVF cycle, we would recommend testing of embryos prior to transfer, and this is called as pre-implantation genetic screening. What we do here is we allow the embryo to grow up to day 5 or even day 6 at times, and some cells of the embryos are taken out and sent for further genetic studies. It is common in older women to have a large number of embryos being chromosomally abnormal. Those embryos are rejected and only the normal ones are transferred so as to get a better pregnancy rate. So these are some of the ways by which we evaluate a failed IVF cycle and plan ahead.